As a clinician, a systematic approach should be followed for an effective head-to-toe physical examination, which include nutritionally relevant areas such as the head, the eyes, the ears, the nose, the throat, neck, upper extremities, chest and back, breast and axilla, abdomen, and lower extremities. And the main components for a proper exam include a general inspection where one would observe for fasting, wasting, cachexia, as well as obesity, any body movement, behaviors, habits, functions and motor skills, and the skin should be checked for redness, jaundice, dark areas, bruises, lesions, as well as temperature and if there's any sweating. The hands should be assessed for transverse ridge, and the interosseous can be observed and palpated for fullness and distribution. The head and hair can be inspected by looking at the scalp for hair quantity, distribution, texture, and color. You can evaluate the thinness or thickness, the dryness, whether there's any depigmentation or corkscrew appearance. And the eyes can be assessed for dryness, the color of the sclera and the conjunctiva can be observed, the corners of the eyes for fissures and redness, and you can assess the fullness and the color around the orbital region overall. The oral cavity would be where you evaluate lips for dryness, redness, as well as the corners of the mouth for any dryness or redness. The tongue can be observed for inflammation and atrophic lingual papilla. Mucous membranes for moisture or dryness. The gums can be observed for any swelling or bleeding, and the teeth can be observed either by having any discoloration, loose or missing teeth, or any caries. And the neck and upper body can be inspected for distension, masses. You would want to assess any muscle and subcutaneous fat longs along the region, like where the scapulas are, the shoulders, collarbones here, scapula here, and shoulders, clavicles, any fat overlying the ribs, and the triceps, and you would also note any sagging skin here. And musculoskeletal and lower extremity can be observed by just observing overall muscle appearance and noting the size and shape of the quadriceps with the calves and rating their fluid accumulation around the ankles. At this point, you could also assess for atrophy, and that is how you perform more or less a nutrition-focused physical exam.